Good evening. This is 21st Century Conversations. I'm Shani. Our conversation this evening is about diabetes. This is a part of OneWorld's health literacy series, and the topic is diabetes education, inches and pounds matter. To have this conversation, I have three guests who are on the front lines, having first-hand experience with diabetes and with diabetes education. They are, Christine, tell us who you are.
My name is Christine Volgmuth. I've had diabetes for about 5 years. I have the type 2.
And you said for 5 years?
For 5 years, that is correct.
Okay, and we'll come back and you'll tell us more about what you're doing, how you're managing. Al?
Hi, my name is Albert Whitaker. I'm the Director of Mission Delivery for the American Diabetes Association, New England. And I'm also living with type 2 diabetes. And I've been living with type 2 diabetes since 2001. And it has been a process, but I've learned to maintain.
Okay, welcome to the table for the first time, the both of you. Beth?
Hi, my name is Beth Caffery. I'm a certified diabetic educator and registered dietitian at Hartford Hospital's Diabetes LifeCare. I'm also the current president of the Connecticut Alliance of Diabetes Educator, which is a local organization of certified diabetes educators in the state of Connecticut.
We talked about that there are many different types of insulin, right? So, Beth, you want to just go over and remind people that the insulin they get is something worked out with their care provider, right?
Correct. It has to be ordered by a physician or a nurse practitioner or...
And how is it decided? How does the provider decide what's the best type of insulin for someone?
Well, for someone with type 2 diabetes, what we'll first try, if we can, are oral medications. And those medications will target different organs in the body. They may target the pancreas, they may target the liver, they may target the muscles. There's different areas. But if someone's blood sugar, even taking the medication, working with the activity, working with the diet, their blood sugars are still elevated, it still means that complications can occur. So that's when we look at the next step, which is maybe your body just needs more help. And you will start taking insulin for that help. That's what your body would do if it could. It's not able to do it.
Yes.
So we're very fortunate nowadays because the type of insulins available are a lot better. Most individuals, if we're going to put them on insulin, we'll start them with what we call a basal insulin, and that's a type of insulin that will work over 24 hours. So it's a 1 shot a day form of insulin that helps manage to bring those blood sugars down a bit. Two common names, one would be Lantus, the other would be Levemir. I should say sometimes for people, Levemir, they may have to take more than 1 shot. But for the most part, it's 1 shot a day. Then we have what we call rapid-acting insulins. And those are nice, too, because they target a meal. Anytime you eat carbohydrate, you can take this rapid form of insulin. It goes in your body and out of your body pretty much just like the food goes in.
So it goes in just to level things off for you?
Correct, around that meal. So if you don't eat, you don't take that insulin because you'll go down. Insulin's a wonderful drug. It definitely brings the blood sugar down, and that's the risk that we deal with. So that type of medication, for some people, it may be 1 meal that they need help with. For many individuals, their body needs help with all 3 meals. They need help with the carbohydrate.
And this is another reason, Beth, that we want to emphasize people the importance of being diagnosed, getting accurate diagnosis, because you need the help of a professional diabetologist to help you to manage the sugar, and to manage your insulin and to target those, the parts that needs to be targeted and balance things out so you don't do vascular damage to your body. So it's not just a little sugar, and it's not just, I'm on insulin so I can eat whatever I want, because there's a cost to everything.
Exactly.
There's a cost to everything. Okay, so the doctor will, or your nurse practitioner, whoever your provider is, will, based on your lifestyle and lots of things going on in your life, prescribe for you a system or a regimen that will help to keep you in balance, right?
And your diabetes educator very often will teach you how to do the injections. You know, it's funny. I just was at a talk last night, and it's not funny, but a doctor spent the time trying to educate someone and taught them how to inject into an orange. And the person went home, injected into the orange. So their blood sugars never got better. They were injecting into the orange, and
Rather than in
actually
themselves. So he was teaching them how to inject themselves by using an orange.
using an orange.
But didn't tell the person.
Well, it was just a miscommunication that occurred, but then the person would eat the orange thinking that they were getting the insulin.
Goodness. You see why we cannot make assumptions?
That's right. So, and doctors have time to see a lot. They have to see a lot of patients. So to send them to a program where someone's going to sit down and spend the time with them and teach them what are the tricks of the trade, how do you properly inject, because that's important. If you're taking
absolutely.
a hormone
and
you're not doing it correctly, you're not getting the full injection.
So tell us now, what is again, because we want people who might have just joined us to know, the American Diabetes Association has a very comprehensive program, but Beth just talked about the importance of good communication between provider and patient. Now, many people, and here's another problem in our community, lack of access to health care. You know, many people who are in Medicaid or other type of government-supported programs might not have as easy access as those who have employer-covered or employer-sponsored insurance. So what is the Diabetes Association, how are they helping people with this piece?
Well, it's twofold. One is this, you know, what we have discovered, whenever we have a health fair and there are screenings made available, because they're anonymous, people can walk in off the street, they can have their A1C done, or they can have a glucose test done, get the results and walk away. We find, you know, invariably, it just fills right up. They'll go just to that and leave. And so what we've been trying to do is really empower, you know, Beth was talking about self-management, and it's so important that once you're living with diabetes, you know, you cannot depend, your doctor's going to give you the guidance, but the onus is on the individual to really begin to think about, how am I going to self-manage? How am I going to self-manage? You know, if I know I eat a banana that's ripe in the morning and it spikes my blood sugar up, then maybe I need to do half of that banana or a quarter of that banana, or maybe not a banana at all. So it's just those things where you're going to learn some tricks of the trade, and really kind of keep, you know, accurate records of what you eat, what effect it's had on your body. You know, if you've done exercise or you've done some physical activity, does that really drop your sugar extremely low?
You know something, I'll tell you, one of the, again, the very groups you talk about, you know, African Americans, Asians, Hispanics, Native Americans, among this group, particularly among Hispanic, Native Americans, and African Americans, we have a large percentage of people who are not the most academically sophisticated. We need someone to teach people, how do you document your food? You know, even the very words we use culturally, you know, within certain groups, those words do not fit into the vernacular of, you know what I'm saying?
But, you know, but I'm thinking
system.
also in terms of this, I think you have to go to where people are.
Yes.
And what I mean by that is, I have to be able to speak the language and I'm not talking about a language, but I'm talking about the lingo, so that people understand. And, you know, case in point, there are times when I have been very hard on an individual, you know, who said to me, well, you know, I'm going to continue to eat what I want. So I said to them, you know, well, can I have 2 minutes? And they said, 2 minutes for what? I said, because it's only going to take me 2 minutes, you know, when they do at your funeral, to talk about what you've done. But what happens is, all of a sudden, the light bulb goes on, and they say, well, wait a minute, maybe this is serious. So it is about going to where, or coming to where people are, but also to be able to talk about foods that people, Native Americans or Latinos or whatever, eat. So we're going to talk about arroz con pollo. If we're talking about a Latino, you're going to talk about arroz con pollo. That is a staple.
Yes.
So I'm not going to say don't eat that, but I'm going to say could you consider a smaller portion?
Yes,
Right.
yes,
Right.
yes.
Right.
Okay? Or if I'm going to eat collard greens, I'm not going to put smoked a ham hock in it.
Or fried plantains,
Right.
or
On it.
recipes.
So it's just those things where you can really talk about, talk about the foods that people eat, but how do you defat them? Mm-hmm. How do you cook them in perhaps olive oil or canola oil?
Yes.
How do you use substitutes instead of the lard or all these other things?
Yes.
All of those things.
Lard.
And it's, I think that resonates with people. And what we've done is, and I think it's been really effective, is we say, okay, we're going to do a cooking demo. So we take them to the supermarket.
Yes.
We let them read the
Great.
labels.
Yes.
They go and they get the fresh produce. And then we get a recipe and we go and cook it. And let them taste it. Let them try it. And then with our support groups, we actually have people who are swapping recipes, healthier recipes. So it starts at the grassroots level, but it's like a whisper that catches fire, because eventually your community begins to start thinking healthy.
People have to come to appreciate the fact that this is a matter of really life and quality of life and health. Mm-hmm. It is not a simple thing. Christine, what do you want to say to people as someone who is living with and managing your diabetes and changing your life? You're changing your BMI definitely by your weight. What do you want to say to people as crisply as possible about the importance of
just exercise? And when you exercise, test your blood sugars, because there's a lot of things that happen when you exercise. And even if you can't get to a gym, get out and walk.
Yes.
I walk on the weekends, and sometimes I wear the hoodies, and you've got the front pocket. I'll throw a couple of cans in there just to add the extra weight.
Yes. Oh, yes, yes.
So, because I don't have the wristbands or I don't have the ankle bands, so I'll just throw a couple of cans in the.
Yeah. So we're not asking people to go to the gym. We're talking about just getting out and
just
walking.
Getting out
it doesn't cost you anything.
Walking as fast as you can, and as hard as you can, and as long as you can, and you start off small. And every day you do maybe 3 or 5 steps more. And you just keep walking and walking and walking. That's the best thing that you can do for yourself.
Okay, I want to tell, before we go off, I want to show some contact information on the screen. The Diabetes A to Z list of topics and titles, definition and information is at the http diabetes.niddk.nih.gov, and the Diabetes LifeCare at Hartford Hospital, as this it's showing on the screen, right? And the phone number is there. So if you're in that area or any place in Connecticut and you want to contact the Diabetes LifeCare group, you can do that. American Diabetes Association, the 3 W's, diabetes.org. And their number is 203-639-0385. The National Alliance for Hispanic Health, they also have a website dedicated to diabetes education, which is the 3 W's, hispanichealth.org/programs/diabetes. The Center for African American Health also has a website dedicated to African Americans, and it's the 3 W's, diabetesinitiative.org/programs/DICAA.html. And then we have diabetes.org, Diabetes Basics, which is gestational diabetes. We didn't get to cover that, but people who are pregnant often get diagnosed with diabetes, what we call gestational diabetes. And if you go to that website, you get lots of information there that defines what it is and tells you how it is managed. And the last one is the NIH, so it's ndep.nih.gov, and that is a National Diabetes Education Program. These are all resources for you to get more information. It is really important. Diabetes is not just a little sugar. It is a disease that affects the body, the key systems in your body, your eyes, your nerve ending, your vascular vessels. It affects your kidneys, the major filters in your body. And it can really, really affect your life. It takes your sight, it takes your limbs sometimes. It is important that you have help in managing your diabetes, getting good advice. As Al said, they take people shopping to show you how to shop. Christine talks about walking and putting cans of, like heavy cans in the pocket of her sweatshirt so that it adds weight and gives her more resistant to walk. Beth talks about the importance of really getting tested, know your A1C, and that is a blood test that gives you a 90-day measure of what your blood sugar is, right? I am so glad you joined us for this conversation. Join us again for another 21st Century Conversation. This is a part of our health literacy series. At OneWorld, we are dedicating to bringing the community good information about health and well-being. I'm glad you joined us. Good night, everyone.